My name is Matt Sorensen, and I am finishing up my PGY 5-year in training. Looking back at training here, I think the biggest highlight is now being at the finish line and feeling ready to be out on my own, feeling confident with my surgical and clinical skills. One great thing about the UT-Knoxville program is they utilize the mentorship model, which is where a resident and an attending work together for an entire month. So whatever the attending is doing, the resident is doing. So you get a good mix of clinic as well as surgery. And one great thing about this model is that you get early exposure to bigger complex cases. So even as a Urology 1 resident, you're getting on the robot, you're starting to develop these skills so that you can really kind of perfect it over the next 4 years. So my wife and I moved here not knowing much about Knoxville at all. Really, I came here because of the program, and I kind of thought it would just be a college town, and it's been so much more than that. We've come to love Knoxville. It's an affordable town. We bought a house. The people here really are nice people, and it's so much more than a college town. There's a lot to do. There is great restaurants, and they got a theater and parks and mountains nearby, and really it has everything that you could want in a town. So I remember going through the interview process or the interview trail, and really things I was looking for in a program is obviously you want great surgical skills. You can only train once, so you're looking for a program that can train you well. But really what was important to me also is that a place where the residents and the faculty seemed happy. And I remember my interview day in Knoxville, not knowing much about the program, but halfway through the day I called my wife saying this is going to be my #1 choice. The residents, the attendings, they seemed happy. They had good relationships with each other. They go to each other's birthday parties, baby showers. It was more than just work. It was more of a family feel. And then talking to the residents, you never quite know if residents are kind of telling the truth with how much they operate or how their skills are. And the residents here just said, if you trust the process, you're going to come out here well trained. And my decision was solidified on my second look. I remember coming in, and I went into a robotic case with Dr. White, and his 4th-year resident at the time was doing the procedure. And I figured at some point Dr. White was going to jump in and kind of take over. And really before I knew it, the resident had done a skin-to-skin robotic partial nephrectomy while me and Dr. White were kind of talking about the case, and the resident really made it look easy. And at that point I knew this place has great training. This place has a great family atmosphere. People are happy here, and it was my #1 choice.